It can happen unexpectedly and have fatal consequences, but a Perth hospital is challenging the way we treat a common lung condition. And the type of treatment, labelled a game changer, may surprise you.
Zachary Vernon arrived at the ED on the same day new research was published.
Your lung, what happened to it?
Basically, I think one just collapsed, just sort of cacked it on me.
The 23-year-old is one of 3,000 Aussies to suffer a collapsed lung each year. It almost always happens without warning.
I was just out on the jet skis with a couple mates and stuff, and then I just sort of felt like I pulled a muscle. Waited a few hours and the pain kept getting worse and worse.
A collapsed lung, or pneumothorax, occurs when a lung spontaneously leaks, letting air collect inside the chest, causing pain and a struggle to breathe. Until now, treatment for a collapsed lung involved a plastic tube the size of a finger inserted into the chest to drain the air, re-inflating the lung. But new research, led by Royal Perth, says doctors should do nothing. It compares patients whose lungs were drained with those that weren't. The drained patients spent 6 days in hospital recovering. The observation group spent just 2. The drained patients had twice the recurrence rate and needed nearly twice the number of days off work.
With all the risk of infection and stuff and the fact that you got to stay in hospital for 5 to 6 days, I just didn't really want to do any of that. I got to leave the same day I came in.
It's a lot more comfortable for the patients. And it saves millions of dollars in terms of hospital bed days, and the patients can go back to work sooner.
Royal Perth is one of 39 hospitals to take part in this study. Doctors here believe their results will now impact the medical profession around the world.
It's expected that this will have an international impact on the clinical guidelines in this field.
Michael Genovese, 9 News.